In this training, we are going to review planning considerations that help ensure people with a wide range of disabilities are able to participate in and benefit from emergency health services. People with disabilities rely on a variety of strategies to maintain their independence, health, and safety. This includes the use of caregivers or personal attendants, service animals, mobility aids, or some form of technology to assist with day-to-day living. Developing comprehensive emergency response plans to provide accommodations for people with disabilities and identifying the resources necessary to implement those plans help local jurisdictions and their partnering public health or healthcare organizations ensure accessibility and inclusion for the whole community. Not all people with the same disability have the same need. Therefore, it is important to not only consider the disability type or label when conducting emergency planning, but also to evaluate the functional needs of people with disabilities. The U.S. Department of Health and Human Services, or HHS, uses a functional needs framework to identify and understand the needs of people with disabilities and others with access and functional needs in emergency planning and preparedness. The framework includes 5 essential functional needs categories: communication, maintaining health, independence, safety and support, and transportation, also known as CMIST. CMIST provides a useful and flexible framework for emergency planning and response, emphasizing the functional needs that should be addressed so that topic areas can be specifically considered. C. Communication. M. Medical or maintaining health. I. Independence. S. Safety, support, and self-determination. T. Transportation. Functional needs related to communication. Some people have difficulties receiving or responding to information. People with communication needs may have reduced or no ability to see, hear, or speak. They may also have limitations understanding or learning. This category includes people who cannot speak, read, or understand English. Tips for providing accommodations to ensure effective communications include: convert documents to large print, ensure electronic documents posted on websites meet Web Content Accessibility Guidelines, or WCAG 2.1. Provide on-site American Sign Language or ASL interpretation and translation services. Play video of important messages recorded in ASL and other common languages on repeat in highly visible locations. Include closed captions. Never ask a child or family member to translate or interpret for a person with a disability. There is no assurance they have training to accurately interpret or translate important or nuanced health information. Always speak directly to an individual, regardless of visible disability or presence of a caregiver. Use simple language and avoid unnecessary jargon during one-on-one interactions and when developing health education materials. Post accessible signage in and around the facility for navigation. Ensure supplies or equipment to provide communication accommodations are readily available and staff have been trained on the process to use them. Train staff and volunteers in disability awareness and strategies for effective communication. Provide or use clear face shields to accommodate those who benefit from reading lips. Functional needs, which are medical in nature. For the purposes of emergency planning, this category includes people who need assistance with daily living activities, such as grooming, bathing, eating, dressing, or toileting. This also includes people who are managing their chronic, contagious, or terminal illnesses, as well as people requiring services or supplies such as medications, IV therapy, feeding tubes, dialysis, oxygen, or suction to continue to manage their medical needs. Tips for providing accommodations related to medical needs. Ensure adequate room to accommodate medical devices or supplies, such as oxygen or feeding tube. Identify areas within facility that allows for privacy when needed. Provide mobile health services, including vaccine distribution. Partnering with local healthcare providers to provide vaccines in a healthcare setting. Consider presence of medical condition when providing health education or instructions. Functional needs related to maintaining independence. Some people use medication or assistive devices to function independently daily. This includes use of mobility aids such as wheelchairs, walkers, canes, communication aids such as hearing aids, computers, medical equipment such as syringes or oxygen, and service animals. Tips for providing accommodations that promote and support independence include: develop plans to accommodate service animals, ensure an accessible environment that accommodates mobility aids, provide wayfinding assistance, provide training for staff and volunteers in physical accessibility, accommodating service animals, and assisting people with a wide range of disabilities. Functional needs related to safety, support, and self-determination. Some people may require support to maintain their physical safety if they experience dementia, Alzheimer's, brain injury, or psychiatric, behavioral, mental, cognitive, intellectual, or developmental disabilities. Individuals may require assistance when making decisions for their own self-determination. A family member or friend might join the person with a disability in an unofficial capacity to assist with decision-making, or as a support person to assist in accommodations, or at the request of the person with a disability. Ensure that a no visitors policy is not improperly applied to a person's caregiver or personal aid. Provide additional room for another person throughout the various areas in the vaccination clinic, such as check-in, sign-in area, waiting room, clinic area, or post-vaccine waiting room. It is important for the health provider or vaccine administrator to understand the roles and responsibilities of the other person before assuming that they are a caregiver, or that they even have an official role in decision making. Caution should be taken not to assume that a person who accompanies an individual is able to make decisions or recommendations. Unless you know otherwise, the person with a disability should always be assumed to be the decision maker. Regardless of who is officially the decision maker, health providers should include the person with the disability in discussions related to their health, effectively answer their questions or address concerns specific to their disability or situation, and should always consider their input, in addition to that of the legal guardian, before making final decisions about delivery of service, type of treatment, or scope of care. Additional tips for providing accommodations that support safety and self-determination include: post signage that clearly states exceptions to no visitor policies for people with disabilities and their caregivers or personal attendants. Develop procedures that address safety concerns specific to that neighborhood, facility, and operation, such as assigning personnel to monitor pedestrian safety in high-traffic areas. Identify and obtain resources necessary to support safety procedures. Designate staff or volunteers to serve as point of contact for those who need assistance. Ensure they are easily identifiable, for example, through highly visible signage or a brightly colored responder vest. Train staff and volunteers on issues related to guardianship and self-determination considerations. Routinely assess facility for accessibility barriers. For example, maintain clear paths of travel. Display highly visible, accessible signage to assist with navigation. Block off inaccessible and other unused sections in and around the facility. Identify and address safety hazards prior to the arrival of community members. For example, repair damaged handrails or grab bars along ramps or bathrooms. Functional needs related to transportation. Transportation is an essential part of emergency planning, including planning for and community-wide vaccine campaigns. People who do not drive because of a disability, legal restriction, temporary injury, age, poverty, or lack of access to a vehicle are included in this category. Transportation needs include accessible vehicles, drivers, and procedures for passenger loading and offloading. A person with a disability may regularly use an accessible transportation resource for daily functioning. Many individuals who require accessible vehicles do not have their own source of transportation and without additional assistance are unable to access the vaccine clinic. Offering accessible transportation to people with disabilities who otherwise would be unable to attend the vaccine clinic. Remember, if transportation services are available to the general public, then accessible transportation services must also be available to people with disabilities. Inclusive emergency planning includes developing the processes necessary to identify who in the community needs transportation assistance, the type of transportation needed, for example, accessible vans, other types of assistance or accommodations needed, for example, service animal, wayfinding, assistance with on or offboarding. Develop procedures for coordinating, dispatching, and tracking accessible transportation services. Be sure to plan for the use of drivers who are trained in assisting people with disabilities as they on or offboard the vehicle. Drivers should also be trained to provide accommodations that meet communication needs. Plan to accommodate mobility aids or medical supplies, service animals, caregivers, or personal attendants when providing transportation services. During the COVID-19 response, many jurisdictions partnered with community organizations who routinely provide accessible transportation services to people with disabilities. Let's review a few questions that can help determine to what degree emergency vaccine distribution plans are inclusive of people with disabilities. Are there components of the vaccine process that require use of specialized technology, such as a smartphone app or a QR code? There should be multiple options, including low-tech options, for community members who are unfamiliar or unable to participate in emergency services because it requires use of the internet, computer, smartphone, social media, etc. This includes learning about vaccine priority groups, registering for a vaccine, identifying vaccine clinic locations, learning about vaccine benefits and risks, learning about availability of accessible services and alternative options. Are there alternative options for people who are unable to use a digital sign-in process? Does the process limit itself to a person requiring a certain skill or function? Will a person with an intellectual disability or a mobility disability be able to follow this process with little assistance? Are registration areas designed with consideration for people with mobility issues or those who cannot stand for extended periods of time? Is there assistance available for people who are filling out forms or receiving instructions? An example, interpreting or translator services, individual assistance with filling out forms, quiet spaces. Does signage follow the guidelines and requirements for ADA accessibility? Are wayfinding services available for those who are blind, have low vision, or have cognitive disabilities? Is accessible transportation available to help transport people with disabilities to the site? Does the distribution plan include individuals who are unable to leave their homes? Are follow-up instructions written in an inclusionary manner and available in multiple formats? Has the facility been assessed for accessibility as well as safety hazards? Has someone with disability accessibility expertise visited the site to identify any outstanding accessibility needs before it is open to the public? Are all personnel trained to assist people with disabilities, including physical, sensory, cognitive, and intellectual disabilities, including vendors or subcontractors, such as hired security guards? Are there disability-related training gaps that can be addressed through engaging or partnering with disability-led organizations or stakeholders with disability expertise? Are plans in place to provide accommodations throughout the entire process, from start to finish, including follow-up services? These questions will assist you in identifying areas or topics to get suggestions from disability-led organizations in your community. Local disability-led organizations in your community can assist with identifying the resources and solutions for meeting the actual needs of your local disability community. Disability-led organizations can also assist in assessing overall accessibility and inclusion. Remember, disability-led organizations are not to tell you if what you are doing is wrong, but to provide an alternative perspective from specialists of people with disabilities that is helpful for providing alternatives and solutions to preconceived issues. Outside partners may include support organizations such as Centers for Independent Living, voluntary organizations active in disasters, and other community services that focus on assisting disability populations, including translation and ASL interpretation services. These relationships are not only a valuable source of data and disability expertise, but also serves as force multipliers for community resources.